Welcome back to Dr. Dentico YouTube channel, and our today's topic of discussion is taste cavity, which is a type of pulp vitality taste. As the name suggests, this taste is used to check the vitality of pulp. In addition to this, we have some more pulp vitality taste such as cold taste, heat taste, pulp oximetry, electric pulp tasting, and laser Doppler flowmetry. This taste cavity is an invasive and irreversible taste that is used when all other tastes fail to check the vitality of pulp. Now, what is the procedure? It means how are we going to perform the taste cavity? For this, we should not use anesthesia. That means we have to do this procedure on an unanesthetized tooth and with proper isolation. We should use a rubber dam to ensure proper isolation. Next, start drilling through dentino enamel junction using high-speed handpiece with adequate coolant. Then record patient's response. With this, you will get two types of response. Either patient will feel pain or it will be asymptomatic. If you reach the dentine structure of tooth and patient start sudden feeling of pain, it means pulp is still vital. In this case, you have to choose a treatment plan for restoration such as class 1 or class 2, whatever is needed. After reaching the dentine, if you have drilled out some amount of dentine and patient is still not feeling any kind of pain, the pulp is non-vital. Therefore, your treatment plan is root canal treatment. Next, let's discuss the indications for using the taste cavity. We use this as a last resort when other tastes are not possible. For example, when a tooth with a full coverage crown is suspected of having pulpal disease. In this case, we cannot go for heat taste or cold taste or any other kind of taste. Therefore, we have to start our taste cavity in these cases. Now, let's move on to the limitations of this taste cavity. The taste cavity can give us information about vitality of teeth, but cannot provide a definitive diagnosis. When performing a taste cavity, it is hard to educate patient of what to expect and how to respond. Patients should understand that this procedure is a part of diagnostic process and not final treatment. Clear communication is essential to manage their expectations. When using this technique, tooth sensitivity, patient discomfort, and variation in tooth structure can affect the results. So this is all about the taste cavity. If you have any doubt related to this, let me know in comment section. Thank you.